to get started in here. We've got 3 talks in here that we'll do this morning. I believe, where did Wink go? Where did I lose Wink at?
The barn.
He's still at the barn? I think he's going to do his talk under here. He had talked about trying to get some soil profiles. I don't know if he ever made that happen or not, but if he shows up, hopefully. Here he comes. He's over there, Carol. First off in here, we've got herd health for the cow-calf producer. If y'all are familiar with this and been coming for years, we always try to get a practicing veterinarian to come in and do our talks for us. Bat came in, and I'll tell this story real quick. So the first year we were here, Jacques Fuselier was here and was doing, we were doing some chute side BQA. And whenever we hit the hydraulics on that chute, the swarm of red wasp that came out of that thing, and everybody hit the dirt. I was on the ground crawling. Jacques was on the ground. I think he got stung about 3 times, so I won't do that to you today.
That's good.
But that was our very first experience here at Goldmine. Dr. Brantley is practicing veterinarian at Union Veterinary Clinic in Farmerville. Very good friend of mine. We've been working together. I guess I've been in Farmerville now for a little over 20 years, and we've had a pretty close relationship. And he calls on me whenever he needs me, and whenever I see his name, whenever he calls me first, it's one of those uh-ohs. This probably is not going to be good. But I appreciate Matt coming over today. This is a really good talk. He put this talk together, some really good practical information. So, Bat, I'm going to turn it over to you. Appreciate you coming.
Good morning, everyone. I don't know, is this working?
Turn this off.
Okay.
There you go.
There we go. And first I want you to know, I guess Jason gets me to do these because I'm certainly not an expert. I've been doing it so darn long, though, that you got to learn something. So I've been doing this for about 39 and a half years. I'm a mixed animal practice. I do dogs, cats, horses, goats, and mostly beef cattle. That's used to do some dairy, but that all went away in the late 90s in Union Parish. And so now everybody up there is mostly cow-calf. They have a few stockers, but not very many. So what we're going to talk about today is things that I actually recommend and what most people do. And you may agree with it, you may not. You ought to follow whatever your veterinarian tells you to do, because he works with you, he knows your situation, and everybody can be a little bit different. So what we're going to start with first is worming protocols, and I've been around so long that every time a new parasitologist comes along, they have to, I guess, find something to justify their job, so they always find something new. And I've seen from recommendations, spring, fall, winter, summer, and basically I've come to decide the best time to worm cattle is when you got them in the chute. For the most part, spring and summer is what fall and spring is what most people do, because you're going to be doing something else to your cattle. Some people this has kind of fallen by the wayside in the last 5 or 6 years. Some people like to worm them 3 times a year. It's probably not needed. And if you're going to do a summertime worming, use a pour-on, because you're going to be working cattle through a chute. It's hot, and you don't want those cattle getting too shot. And also, you will get some fly control from a pour-on wormer. Now, don't let the experts say you're saying that, because that's a no-no. You shouldn't be using an internal parasiticide to stop external flies, but it will work. So I think you need to worm sometime in the spring, probably March, April. This is all in a handout that you probably got. And then again, maybe in the fall, October, November. And what products do you need to use? Well, I got on this handout that there's 2 classes. Actually, there's 3 classes, but the 3rd class I'll mention, but it really, in my opinion, doesn't have much practical worth for cattle. And the first one is the white wormers, or the Benzematazoles. That's the drenches. That includes Panicure, Safeguard, which is the same thing. It's fenbendazole. Synanthic, albendazole, or valbazin. And then you've got the 2nd class, which is your ivermectins. They're all in the same. That's ivermectin and all the different generics that go with ivermectin. There's Dectomax, There's the other one that slips my mind right now. So you need to rotate those some. The latest recommendation we're going to get into in just a minute is that you use both classes at the same time. I guess I need to mention the third class, and that's organophosphates. That's an old drug. Some of you, as old as I am, probably remember levamisole or tramadol. It was an injectable. Also came as a bolus. Had to be real careful with it in Brahma cattle or Brahma cross cattle, because you overdose them and they'd fall over dead on you. The other one in that class is the Pyrantel or Morantel, Strongyl T. You might use it in your dogs. And I looked it up last night. I Googled levamisole. And the only thing I could find that's on the market right now is a powder that you dilute to make a drench. And it's still approved for cattle, sheep, and goats. Well, not for goats, but for sheep, and we use it in goats. So I don't think that's a very good recommendation for cattle, because it's just old. If you want to use it and you want to drench them with it, mix it up as a liquid and drench them, that would work. I didn't think there was even the Morantel or Pyrantel was even approved for cattle, but I found that there is one form that is. It's a feed, and you can buy it. You have to feed 1 pound per 1,000 pounds of body weight. That's a lot. So I don't think that's really that practical. So we kind of left with the benzematazoles, or the white wormers, and the ivermectins. If you want to use one class, like the benzematazoles, I think you're better off to use it in the spring. And that's because of the insisted ostratagia that you have to work with in the fall. They're probably not as good with those as the ivermectins are, the ivermectin. And then in the fall, if you're going to use another product, then use one of your ivermectin products. The Cydectin, that's the one I couldn't remember a while ago. Dectomax are one of the ivermectin products. So, the big thing now is resistance. And every species has had it. Started out with goats. They're resistant to everything now. Every anthelmintic we have, goats don't respond. Now in dogs, they're talking about hookworm resistance in wormers. We've had horses that are resistant to all the wormers, and now we finally got around to cattle, and there is some resistance in cattle. The best way probably to combat resistance, if you think you've got resistance to parasites, is to use two classes at one time. So we use a benzematazoles or a drench and one of the injectables at the same time. The experts tell us we won't get resistance. That remains to be seen. We probably will at some time or another. But if you think you have resistant parasites, then that's probably the way to try to manage it. How do you know if you got resistant parasites? Well, you've got a bunch of cattle that look bad after you've dewormed them. That's what everybody wants to say. I've had more than one person come to me in the last couple of years say, man, that wormer's just not working. We got to do something else. I said, well, hey, no, it's not working. Well, my cows look bad, or they've got diarrhea. Okay, let's bring some stool samples in and let's see if it's not working. I can tell you one instance. These were feeder type cattle. They were on baleage or haylage, which is in sow grass. And they broke with just really bad diarrhea. I mean, it was water. Well, they got worms. Well, when did you worm them last? Well, about a month ago. Let's bring some stool samples in. Let's read it. Okay. Well, they brought me the stool samples as they were running them through the chute and deworming them again. And guess what? There was no worms in there. Their wormer had worked. Well, what ended up being the problem was the baleage had caused a ruminitis and an acidosis in those cattle, and that was what was causing the severe diarrhea. So just because you got diarrhea or they're not looking good, maybe you need to take some stool samples to your vet and let them run some fecal egg counts, and let's see what's going on. Another instance, producer told me, he said, you know, the wormer's just not working. My cows look bad. They always look bad. They're not gaining weight. Okay, let's get some stool samples in. Well, okay. One thing led to another, and I'm not criticizing, But that was the last thing they wanted to do. They wanted to come to me and say, let's put a wormer in them because it must not be working. Let's change something. We finally got some stool samples in. He wormed them, and he brought me some stool samples. I said, well, wait 2 weeks. Do me this. Wait 2 weeks. Bring me some more stool samples. Just walk out in the field. You see some cows having a bowel movement. Pick some up. Bring it to me. He did this time. Guess what? There was no parasites. Well, why do they look so bad? Well, overgrazing, too many cows in his field. And that's basically, he came to that realization on his own. And so, if you think you've got resistance, let's do some lab work. Let's do some stool samples and see if it really is resistance before you start blaming the wormers that they aren't working. Because honestly, I haven't seen many instances where you dewormed and it just totally doesn't do any good. The new thing that's coming along about resistance is a program called Refugia, and I'm certainly not an expert at it, but you're going to be hearing a lot about it in the next few years because it's true. Worms are getting more resistant to the anthelmintics we have, and as far as I know, and as far as any of the drug reps tell me, there are no new anthelmintics coming down the pike. So guys, we're left with what we have right now. So Refugia is a program to where basically instead of what they used to recommend, the experts, you know, you got to worm everything all the time. Refugia means you don't worm some of your cows. If they look good, don't worm them. Or if you have a separate herd that you do some fecal egg counts on and your fecal egg counts are low, don't worm them. Refugia actually means you've got two types of parasites. You've got the ones that the anthelmintics kill, and you've got the ones that are getting resistant to the anthelmintics. Well, the idea is if you kill all the ones that are sensitive to the anthelmintics, then all you've got left to be put out on the ground and to grow is the ones that are resistant. So, let's don't worm some of them. That way they'll have parasites, some that are resistant and some that aren't resistant, and so they're competing with one another. Now there's a lot of other things in this program, but that's basically what it amounts to, is that you're worming some of your cattle some of the time, or you're not worming all groups at least once. Now, a lot of ifs, ands, and buts in the Refugia program, and you've got to be rotating pastures. You've got to have a clean pasture, and in the south that means about 3 months dormancy in the hot summertime. And maybe y'all got a lot of land, but honestly, most of the people I deal with, they don't have that much pasture. But that's all. You're going to be hearing a lot more about Refugia in the next few years because basically that's all we have left. All right, now we're going to talk about liver flukes a little bit. In the hill country in Union Parish, really don't have much problem with liver flukes. Have two producers that have cattle that run along Luder Bayou, and they always had a problem with cows didn't look good and wormers didn't work. And so we started worming for flukes, and that kind of took care of the problem. If you're from this area where there's a lot of low ground, probably you may have problems with liver flukes. Flukes have to have a snail, a limnid snail, to be able to reproduce. The limnid snail lives in areas that are swampy or water that stands all year long. So if you've got a low-lying bayou or slough or these water holes that come up when the bayou comes up and then goes down when it goes down, then you might have some flukes. If you think you do, take some samples from your cattle, take them to your vet. I can't run them, I have to send them off, and then they can tell you if they have flukes. There's two drugs that will kill flukes. One of them is the ivermectin plus, or Ivomec plus. It's Corcelon is the drug in it that kills the flukes, and the other is albendazole. Albendazole is one of the drench wormers, and you can use it in rotation or in combination with one of the injectables. Albendazole's been out a long, long time. When I was in vet school 100 years ago, and actually this is like in 1981, they were doing clinical trials on albendazole in southern Louisiana and Cameron and down in Bellchase. And we actually used a drug. They didn't have a name right then, but they were doing the drug trials on it for liver flukes, and that's why it came out. If you want to use albendazole, I'm going to mention this, and there's a sheet on it in the a picture on it in your notes. There's a precaution that says don't use in cattle 45 or days less bred, or 45 days after you pull the bulls off. And the way legal things are now, you probably shouldn't do that, because if you think you have a problem and cows have aborted some calves because you used Valbazin, then if you tell the company, hey, yeah, they were less than 45 days bred, they're going to say, that's on the label. You're your own warranty station. But I'll tell you that I have used it in cattle through the years when this stuff first came out in the 90s. All ages, all stages of gestation, never had a problem with it. I asked about why the precaution was there, and I was told at that time that they had done one clinical trial with a group of heifers. They had bred, knew they were pregnant, dewormed, came back. There was one heifer that wasn't pregnant then. They wanted the drug on the market. They had a market for it. So the FDA told them, you got to put the precaution on it not to use in cattle less than 45 days bred, or we won't give you a license. And that's why they did it. That's why it's on there. Once again, I don't think there's a problem with it, but it's on the label, so you probably shouldn't use it in cattle less than 45 days bred. All right, vaccination. There's probably as many vaccination protocols, and I know there's as many products around as there are us, but I'm going to tell you what I use and what I recommend. May not work for your situation, but it works for most producers that I do business with. And what we're going to talk about is just basically what I consider the bare minimum. This is what you ought to be doing with all your mama cows and bulls and calves. There's a lot of other things you can vaccinate for. Depends on what kind of problems you're having. So once again, work with your veterinarian, and he can devise a lot better protocol for vaccinations than I can, because he knows your situation. We're going to start with calves. All calves need a blackleg shot. Bottom line, I still have people tell me, I never vaccinated blackleg, I never had any. Well, you may not have, but if a situation comes along and you have a flood, or you go through and plow up the ground really deep, you bring some of those Clostridium spores to the surface, then you could have vaccinated your entire herd forever for what it would cost you by losing one or two calves to blackleg. So in my opinion, blackleg is a must. When do you want to do it? My recommendation is, if they come through the chute and his navel's not wet, give him a blackleg shot. You're going to go back and do it again. If you read the label, labels are going to tell you to give one, come back in 3 to 4 weeks, give a second. If you do your vaccine between 3 and 6 months of age, then you need to do a third. What type of blackleg? Well, there's about a lot of different combination products on the market. I used to recommend a 7-way blackleg, didn't include Clostridium hemolyticum, because we didn't have flukes in our area. You won't have Clostridium hemolyticum unless you got liver flukes, because then the bacteria gets in the necrotic tissue in the liver that the fluke causes, and causes a disease called red water. In other words, they're peeing red water. And that's why it got the disease. And you know, I have changed my recommendation now to say that everybody really needs to use an 8-way Clostridium product. And that's because if you buy calves, you may not know where they come from. They could have some liver flukes. Or if you sell calves, you don't know where they're going. So maybe they'll be in some fluke country, and that way you know they're kind of been protected. And the 8-way is really not that much more expensive than the 7-way. And that's what I use as a Merck product called Vision 8, and it's an 8-way blackleg. Now, a 9-way blackleg product has tetanus in it. And if you're going to ban calves, you need to give a tetanus shot. You're supposed to give it and then come back, and I've set my timer because they only gave me 30 minutes and I'm running way over behind.
You're good, keep going.
Okay. You need to give a tetanus shot if you ban the calf. You're supposed to give the tetanus shot, wait 3 weeks, give another tetanus shot, then ban the calf. I've been guilty of not doing that myself. I don't know many people that do. So at least when you ban that calf, give them a tetanus shot. I've even come to the point that if you're going to catch them out in the field when they're just babies and put that little bitty band on them, give them a tetanus shot. Give them a 9-way blackleg. It's got tetanus in it. It's got all the other products in it also. And you can give a 9-way to everything. It's just more expensive. Hits you in the pocket a little bit worse. I used to say if you're going to cut a calf surgically, you probably don't need a tetanus shot. Well, after I've seen 2 or 3 dead from tetanus, from being cut, kind of amended that recommendation too. If you're going to castrate a calf either by bands or surgically, you need to give them a tetanus. So let's use that. You might as well use it in combination with something else. So let's use a 9-way blackleg product. The one I use is called Cavalry. It's made by Merck also, and it's a 2 cc dose, just like all the rest of it. I've already told you that, I say if you're going to vaccinate calves, then you need to give them a blackleg every time they're in the chute. And I still recommend that because blackleg is cheap, and you can't give them too much. That's what I recommend. Now, what else are you going to give calves? Kind of depends on how you're going to market them. If you know that you're going to wean that calf or take him off his mama, send him straight to the sale barn, you probably don't need to use a respiratory vaccine because you probably won't get your money back. If you're going to sell that calf video auction, or you're planning on maybe grazing them some before you sell them, you probably need to use a respiratory product. And the respiratory products are IBR, BVD, PI3, and BRSV. And you can use a killed or you can use a modified live. I recommend you use a modified live. The protocols you use are on calves. You can do it 2 ways. While they're still on their mama, use a modified live product. The one I use is called, and you got a picture in there, it's called Vista-1 Sub-Q. It's got all the respiratory viruses, plus it's got the 2 bacteria that cause shipping fever, which is Pasteurella hemolytica and Manheimia, or maybe I got them backwards. It used to be both Pasteurellas, but they changed the name on us. But that's the 2 main shipping fever bacteria. If you're going to use a modified live in a calf, make sure you don't inject the mama with it, because if she's pregnant, guess what? It's going to abort her 100%. Some of these vaccines have precautions on them that you don't want to use it in a calf. If the mama's pregnant, if she hasn't had a modified live vaccine for BVD, and they do that to cover their butts, honestly, because they don't want any kind of, you can shed virus when they use a modified live, and they don't want the mama to pick that up and maybe cause an abortion that the company would be liable for. I can tell you that I've been using modified live in calves for years and years and years. It never has happened. Might on your day, it might do it tomorrow, but so far it never has happened. So if you're going to use this, I would recommend the modified live vaccine that's got IBR, BVD, PI3, BRSV, and the 2 Pasteurellas. Give it while the calf's still on the mama's side. Whenever you work the cows, give it to the calf. Just don't give it to the mama. Label says you're supposed to come back in 3 or 4 weeks. Repeat it. How many of y'all gonna get the cows back up in 3 or 4 weeks? Probably not. So when you go to wean, do it again. Other method is that if you don't know how you're going to mark these calves when they're still on their mamas, hold off. If you decide you're going to send them right to sale barn when you wean them or when you take them off mama, you don't need it. If you're not, decide you're going to keep them, give them a vaccine then, wait 3 weeks, 4 weeks, come back, do it a second time. You've basically backgrounded your calf. And that's what you need to do. All right, what we're going to do for mamas and bulls? Well, I'll tell you that what I use is a vaccine that's got the viruses in it, IBR, BVD, PI3, a 5-way lepto, and vibriosis. Vibriosis is a bacteria that can cause early term abortions. I think that's baseline of what you need to do. Now, what I use is a kill product called ViraShield 6 plus VL5. I think there's a picture of it in your handout. You can use several other different vaccines. Cattle Master's got one that's got all the products in it. It's a Cattle Master 4VL5, I think, that's got lepto in it. You can use Cattle Master Gold. Cattle Master Gold is a little bit different because the part of the product is modified live, but the BVD portion is killed. But the Cattle Master Gold doesn't have a leptovibrio in it, so if you're going to use that, you're going to have to give them a separate leptovibrio shot. I'm lazy. I only like to stick them once for their vaccine, so that's why I use the ViraShield. And it's got it all in there. ViraShield 6 plus VL5. It's killed. The downside to it, if there is a downside, is it's got a 60-day slaughter withdrawal, and that's because of one of the preservatives that's in it. So don't get one and go send it to the sale barn because it can get you in trouble. It does have a 60-day slaughter withdrawal, so you want to do that and observe that product. If you do use it, don't send them to the sale right away. Other thing that's coming along, and I really want to talk about this some, and I think it's really important because used to, when you talk about anaplasmosis, I used to tell everybody, go out and look. If he's yellow where he should be pink, like inside the vulva, or around his conjunctiva of his eye or his third eyelid, then you probably got leptospirosis. Lepto is caused by, anaplasmosis. Anaplasmosis is caused by Anaplasma marginale. It's a bacteria that can hide in blood cells in the cattle. You can have carriers. And the way your cattle get it is you've got a cow that's a carrier. She doesn't get sick probably, but she's spreading organisms to all the others by any type of direct blood transfer. In other parts of the world, ticks are very important in spreading anaplasm. In this part of the world, ticks probably aren't, they can spread it, but they're probably not that important because the fire ants eat all the ticks. Horseflies are probably the biggest thing that transfer anaplasm in our part of the world. So we've got a lot of horseflies. As far as I know, there's not an insecticide that kills a horsefly. So anaplasm, like I said, I used to tell you if they were yellow, you probably got anaplasm. I'll tell you in the last 2 to 3 years, every cow I've seen that I've proven has got anaplasmosis, it's just found dead. You don't get the chance to see them sick. And you've got to diagnose it by doing a blood sample and doing a PCR or an ELISA test from the lab to prove that's what they got. And I don't know why it changed, but for some reason it has. And so there's about 3 ways you can try to prevent anaplasmosis in your cattle. One is the old way. Let's go get some Aromycin, let's put it out, keep it out for them. It'll help the foot rot, it'll help the pink eye, and it'll take care of anaplasmosis. Well, FDA fixed that for us because they've outlawed chlorotetracycline. It's not legal for anything but preventing anaplasmosis. And now you can't get it unless you have a veterinary feed directive. I can't give you a veterinary feed directive unless you've got a dead cow or a sick cow that I've run blood work on, and producers are coming in. I've always had anaplasm, so he's writing them VFDs, and they were going off and getting the RMIs and putting it in there, and he got called on it. I said, why are you doing this? Well, they've always had it. Well, wait a minute. How you know they have it now? Well, they always have had some. You got any proof that they've ever had any? Well, no. So the federal government has kind of shut some of that down. I like y'all, but I don't like you enough to have the FDA come in and flap their badge open and say, okay, I want to see all your records. So I don't write many VFDs for that. One thing, the feed stores in Union Parish, you can't get aromycin anymore. Nobody's got it. And you can get somebody to formulate it for you, I guess, but another way to prevent anaplasm is you can go through and give them all a dose of LA200, LA300, which is oxytetracycline, and that'll work, but you're going to probably have to do that every year too. And then we have a vaccine. We're lucky. We're in Louisiana. There's a man that taught me in vet school, Dr. Gene Luther. And he decided way back that, you know, I'm going to come up with a vaccine that doesn't cause neonatal isoerythrolysis in calves, which is basically when the calf drinks his mama's colostrum, he gets infected and he dies. So the old anaplasm vaccines cause this. Dr. Luther came up with one of these, and it doesn't. He's never had a case of neonatal isoerythrolysis. He has done all of this out of his own pocket. He patented the vaccine. It's still experimental because it's not produced commercially, because he doesn't have the money to go through and prove all the things you got to prove to get a vaccine licensed. He doesn't sell it. But in Louisiana, as far as I know, you got to get it through a veterinarian. It's a little bit pricey up front. It's around $7.50 a head, and you need to give one dose, come back in 4 weeks, give a second dose, and then another dose annually. But I can tell you, if you use Dr. Luther's anaplasm vaccine, you will not have anaplasmosis. And I had a producer last winter. He had a lot of dead cows. There was nothing really on a necropsy that showed, and I did some blood work. Every one of those cows had high PCRs for anaplasmosis. Is that what killed them? Well, maybe not, but it sure didn't help. And vaccination is the way to go, guys, if you've got anaplasm. So think about that. Do what?
Did he find all of them dead at one time?
No, just the one. He'd find one dead. You know, it's winter time. Yeah, well, he ate too much. He rolled over and bloated. And some of them were real thin. And anaplasm on those cows probably did have something to do with it. So there's a lot of reasons for cows to die in winter. And I don't know that that was 100%. The point is that every one of those cows that we tested had PCRs for anaplasm. And that's pretty disturbing when you've got that many in a herd. Now, I've tested some other herds that had poor doing cows. This was a purebred breeder. He didn't have anaplasm. They never showed up any PCR for anaplasm. What he had was leukemia. And that's a whole different talk. So I just think you ought to think about using vaccines for anaplasm if you've got the problem. And if you've got cows that die, especially this time of year, unexplained, you just find them dead, maybe you ought to have to get them checked and find out if you do have anaplasm in your herd. All right, I probably talked way more than I needed to, and that's about all I got to say. And I'm not an expert, so use your own veterinarian and take his recommendations. I guess the only reason I'm an expert, you know, they have a definition of an expert if you're more than 35 miles from home. It's 63 miles down here, so I guess in that instance I qualify as an expert. That's it.
Y'all got any questions for Dr. Brantley?
What kind of, for foot rot, what do you?
There's a vaccine for foot rot. If you read the trials, it's probably only about 65% effective. It is a commercially produced vaccine. Some of the people that have used it thinks it helps, but basically there's nothing you can put out right now to prevent foot rot in beef cattle that I know that works. You know, dairy cattle, they talk about foot baths. You can't have a foot bath for a beef cow. So if you find one, it's basically get it up, treat it topically with strong iodine, Clorox, whatever you want to put on it, and a dose of LA200.
How's that dart going to shoot?
All right, anything else?
Any other questions?